My name is Anne Waiguru, Chair of Council in the Governor Kenya County.
Thank you, Madam Chair. I would like to request, Madam Chair, how much time do you need?
Thank you, Chair. First, we want to start by acknowledging the receipt of a letter from the Senate requesting for comments on the budget policy statement, and that's why we're here. Having reviewed the three documents, the Council does not have comments on the 2024 MTDS and MTRS, which is the medium-term debt management strategy paper and the medium-term revenue strategy. But the Council hereby notes the following on the budget policy statement. We note that the projected allocation to counties for the financial year 2024-2025 has been revised downwards from 401.6 billion that was in the 2024 draft BPS to Kenya shillings 391.1 billion out of the total ordinary revenue of 2.948 trillion. The 10.52 billion being allocated as the road maintenance levy fund conditional grant is an ordinary revenue which comes from the fuel levy fund and is not part of ordinary revenue being shared under the division of revenue bill. The Kenya Roads Board read a letter dated 13th December 2022 stated that the board has not allocated RMLF in respect to the financial year 2023-24, as these funds have been allocated to Kenya Rural Roads Authority and Kenya Urban Roads Authority. This is a precedent-setting decision that has not been vacated. This is in spite of Section 18 B and C and Part 1 of the 4th Schedule and Section 7.1 of the 6th Schedule of the Constitution. Secondly, the projected ordinary revenue is set to grow by 15%, an absolute revenue increment of 376.9 billion from the revenue that underpinned revenue sharing for the financial year 2023-2024, which is 2.571 trillion. However, out of the 376.9 billion, only 5.7 billion, 5.6%, is being added to the county's baseline allocation of 385 under the 2024 BPS, which the Council deems as disproportionate and inequitable, and the Council therefore proposes an allocation of 450 billion for the financial year 2024-2025. That is Kenya shillings 439.5 billion as equitable share and 10.5 billion from RMLF as shown in the table below. So provided the summary as follows. One, the baseline allocation in the previous year is 385.4. The adjustment for revenue growth is 21.6 billion. The adjustment for counties because of additional expenditures in financial year 2024-25, which requires we are overhauling all the medical equipment that have come to the end of their life and they have to be replaced. That will be about 5.9 billion every year in total for all the counties. KIPES project, which we have all budgeted a minimum of 250 million shillings for phase 1 per county, which is 11.8 billion. CHP stipend, which we all increased. We used to pay less, but now we're having to put 2,500 stipend on our side and the national government puts on their side, when it's coming to 3.2 billion for all the counties. And then for statutory deductions and our county contributions for SHIF, which is the new health insurance fund, the laws that have been passed, the NSSF, the housing levy deductions, and the IPPD annual adjustments that are required by law, the minimum 3% requirement for inflation. That comes to a minimum of 11.6 billion shillings. Just to give you an example, for Kirinyaga County, alone, for mess, I would need about 170, and I'm one of the smaller counties. So counties such as Nakuru and Nairobi, to replace the equipment in these hospitals for the annual payments will be in excess of 200 to 300 million shillings. When it comes to the KIPES, all of us are at standard 250, but some counties will spend a little bit more. And for CHPs, for example, in Kirinyaga, and again, I'm the smallest, amongst the smallest, we got about 835, according to the list of the national government, for 1,200, according to the national list. I am paying 36 million shillings. So if you add up the numbers, it's an increase to support the national government priorities and flagships of close to, for a small county, between 400 and 500 million shillings. So that comes to that 2.5 billion. Then there is the RMLF at 15%, which was a summit decision, at 10.5. Computed equitable share of revenue only, if you add all those, they come to 439.5. And then if you put the inclusive of RMLF, you find it comes to 450. The percentage of the last audited and approved accounts for the financial year, 1.6 trillion and 73.7 million shillings. It comes to about 26.3% of the last audited accounts of 2019-2020. Percentage of total shareable revenue, however, it comes to 14.9. That is what we're proposing. Our proposal brings it to 14.9. The Constitution requires it to be a minimum of 15%. So the justification of the Council have given, one is the emerging issues occasioned by additional expenditure to counties that I have mentioned, the mess, the new medical equipment, the national programs such as KIPES and CHPs, the housing levy, the social health insurance fund, the annual salary increments, and the transferred library museum functions. The economic growth outlook, the Council proposes an adjustment for revenue growth of 21.6 billion, the average growth of 5.6% as projected. And then again, also considering inflation, overall average annual inflation has remained above 7.5%, with both food and fuel expenses going high. And if you consider we manage hospitals, that we need to provide food, and to run county operations, you need operation and maintenance costs, which include fuel. The expenses have gone up. Most of us have adjusted our budgets because of inflation. And then the weakening shilling against the dollar, which has increased cost of building material and critical pharmaceutical products. Even to just maintain our hospitals, we have had to increase the expenditure. And then declining counties' share of revenue as percentage of ordinary revenue. This is a great concern, because if you look that over the years, equitable share allocation as a percentage of ordinary revenue in 2013 was at 14. In 2014-15, it went up to 16. It went up to 18 the year of subsequent year, and it went up to 23.7% and 25% in the year 2017-2018, 2018-2019, and 2019-2020, and continued up to 2020-2021. And then when we came to 2022, we saw a decline to, sorry, I'm reading the wrong column. It went down, it went up to 22.7 to 22.5. In the year 2016-2017, 21.5. 2017-2018, 22.1. And then 2018-2019 and 2020, it moved from 21% to 20.1%, 20.3. In 2021-2022, it was 20.8. In 2022-2023, we went down drastically to 17.3. And then In 2023-2024, which is last year, it's gone down to 15%, and barely on the bare minimum. And now the proposal of 2024-2025 is 13%, 13.5%. Now, the Constitution requires a minimum of 15. Minimum. It says minimum. If you look at this trend, counties will be non-existent or will be unable to operate in the next couple of years. I think that is why you've seen that we have come in large numbers today to just make statement on this issue of the revenue allocation. And the revenue allocation, we have justified it according to needs. If you look at the graph that we've presented there of ordinary revenue versus the amount of the percentage that we're getting, the ordinary revenue is actually going up. There was a year in 2019, 2020, 2021 that it dropped a little bit, but it has been on an increase up to 56.3. Yeah, but the national government share is going up, but the share of the counties is coming down. So we need a great intervention from the committee. And then I think on the specific comments, one, chapter number 4, paragraph 4.2 on county financial management and division of revenue, enhancement of county government's own source revenue, provision. It says that the National Rating Bill was passed by the National Assembly and forwarded to Senate on 31st October for consideration. The bill provides for, amongst other standards, in the way ratings and valuation is conducted in the county, and how to deal with properties cross-cutting in more than one county government, and the procedure for claiming and payment of contribution in lieu of rates, and timely updating of value rolls by the county governments. More importantly, the bill will repeal the outdated valuation for Rating Act Cap 266 and Rating Act 267 and align the property rating legal regime with the devolved system of governance. The COG proposal is at the National Treasury to provide a payment plan for the outstanding contribution in lieu of rates to county governments amounting to 13 trillion shillings. On the second 4.4, on the division of revenue for financial year 2024-25, as indicated, and this I've already deliberated on, and I don't need to repeat. I think we are clear on where we stand on this matter, on the 450 billion shillings. On the equalization fund allocation for 2024-2025, the National Treasury proposes to allocate 7.867 million to the equalization fund, 7.8 billion to the equalization fund, being 0.5% of the actual revenues raised nationally. Understanding, our proposal is paragraph 338 be amended as follows: that the National Treasury proposes to allocate 8.37 billion to the equalization fund, being 0.5% of last audited accounts, as approved by the National Assembly, nationally of 1.6 trillion, and Kenya shillings 3.5 billion towards payments arising from equalization fund arrears. Additional allocations to county governments in financial year 2024-2025 The following conditional grants are not properly captured in the 2024 BPS. The County Aggregation and Industrial Parks, CAIPs, amounting to 4.5 billion. This is the amount that is outstanding for 29 counties that wasn't allocated the government counterpart funding. Number 2, in the IDA World Bank Credit and Kenya Urban Support, the 1.575 million urban institutional grant, or 1.5 billion urban institution grant ought to have been allocated to counties in the financial year 2020-2023 and 2024, and the urban development grant UDG amounting to 7.8 billion should have been allocated for the financial year 2024-2025 as per the letter that we have attached with our document. Further and specific health issues are expounded as follows. Under paragraph 30, the issue under program 8,429 workers whose contracts had lapsed have been renewed, and the recommendation is that the BPS need to specify renewal period and capture associated indicative costs to be provided for. In paragraph 31, on electronic community health information system, the BPS does not provide for resource to roll out the e-cheese in 47 counties. The BPS should have a budgetary allocation to roll out e-cheese in 47 counties. Paragraph 32, the establishment of primary healthcare networks, the BPS 2024, to provide for funding towards establishment of PCNS across 47 counties. Currently, only 1 of 5 PCNs out of 315 PCNs have been established. Excuse me. And paragraph 260, the allocation to Ministry of Health of 147.5 billion and 155.5 billion and 160.1 billion in the financial year 2024-25, 25-26, 26-27 respectively, that the BPS has allocated higher resources to the ministry compared to the counties, even when the health services is a devolved function. The combined 47 county health budgets is less than what the Ministry of Health has been allocated. The BPS to increase allocation to counties accordingly. In paragraph 328.4.6, recruit and deploy 100,000 community health promoter CHPs throughout the country. The actual number of the CHPs is 107,831. Therefore, the annual budgetary is 3.234 billion. No, it's billion. It's billion. It's billion. As opposed to 2.5 billion stated in the BPS. So it is 3.234 billion as opposed to 2.5. Please accept the assurance of our highest esteem and consideration. We regard the committee very highly, and we hope that those issues that we have raised will be considered by the committee favorably. I submit, Chair.
Thank you.
As we come to this house, we come here to address senators. We come to the house that was set up to protect devolution. And nowhere else has devolution been clawed back the way it has been done this time. So as we come before you and with the presentation that has been made, we are clearly just laying out the real picture that for quite some time now, we have continued to see devolution lose at the financial allocation. We end up with very little money, and as we sit here, all of us are well aware that the cost of living has really shot. The money that is being allocated from 385 to 391, the 6 billion is not enough to pay for our annual increments as salaries. As we sit here, Chair, counties have not been able to hire ECD teachers across the board, which is a county function. So as we come before you, we want to plead that at this point, where the BPS is being, you have the opportunity, despite also the National Assembly having their own, at this point, we pray that we protect devolution by allocating requisite funds that are constitutional. I have always made this statement that the Council of Governors has never asked for any extra function that is not in the schedule 4. We only demand and request that as we look at all the areas that have been mentioned, as you look in your wisdom, as you look at the way the allocations have been done, because we cannot continue. When Kenyans woke up one morning and decided that they wanted devolution, they were saying they were sick and tired of a centralized system. And they wanted to be able to walk to Kirinyaga, find Governor Waiguru and tell her the hospitals are not working. Today, you cannot walk to national, to the State House and go and tell the president that the hospitals are not working. And that is why maybe they wanted a devolved function, a devolved system of government, where they can see their leaders. They are able to reach them. And these things are. So if we proceed in this kind of way, unfortunately, we are, devolution is is on the deathbed. Thank you.
Senator Governor.
Thank you so much, Chair. It's true, Senator Governor. So I'm really at home here. I want to thank my colleagues and Chair for a very eloquent presentation, and really to emphasize one or two points. Number one, it's the place of the Senate. In the history of devolution, even when you were Governor, Chair, the Senate has always stood with the counties. The first Senate, the second Senate, and this Senate, needs to play that role. In fact, for us, we were very surprised last time when, for the first time, the Senate did not defend increased allocations to counties. I think you have seen for yourselves what is happening in our counties. I really sympathize with my colleagues. Some counties even have not been able, to pay salaries for some time because of the, limitation in on-source revenue when there are delays in exchequer. But on the points in BPS, first of all, there's a structural problem in Parliament where the Senate considers its BPS, does a report, and the National Assembly considers BPS, does a report. Both reports are taken to Treasury, and there's never a matrix of implementation or consideration of the Senate's views. In the last 5 years, that is what has been happening. Ideally, one report should go through both houses and have a report of Parliament on BPS. Because what they do, they will take National Assembly recommendations and put ours in a drawer. I hope that doesn't happen this time. When we ask for this money, I've heard people saying, including leaders, that where do you want this money to come from? There is no extra money. Counties are not asking for extra money. We're asking for the money that is already there, but misallocated. The money is there. The money is in health. The money is in agriculture. The money is in education. The money is in functions. Water, and I'm very happy that you did what you did on water recently. Now the Senate is coming back to the house that we know it. I'll give you an example in health. In Nairobi County, I run 125 health facilities. The national government runs 3. Kenyatta, spinal injury, and Mathare. But Mama Lucy is a county government. Pumwani is a county government. Magathi is a county government. Mutwini is a county government, and another 121 facilities. Yet the allocation to the ministry, which ideally should only deal with a national referral hospital, which I think are around 4 or 5, and policy, is 160 billion. I have 7,480 community health promoters. I know there's excitement that now there's increased 2,500. I've been paying them 3,500 since I became governor. I've already been paying. It's not a new thing. So if you compare that, the entire allocation to all 47 counties is much less than what is going to a department that should be providing only policy and dealing with less than, let me just say, even less than 10 facilities for health. There is something wrong there. So I'm not asking the Senate to do to look for money from, from the moon, just to play its role in allocating properly what the Constitution provides for in the fourth schedule, which is the functions of counties. Number two, because it has been mentioned, and I'd really want us to emphasize the issue of rating and the issue of making sure that national government entities provide for contribution in lieu of rates. The national government, for instance, owes Nairobi 61.6 billion in rates. Yeah? Rate payments that have not come through. Some ministries have been paying, some have not been paying. And our appeal had been that these ministries should put in their budgets the payment for rates. Even let's start with this year's rates. So the debt we can talk about. Same as Kisumu, same as Mombasa, same as Nakuru, same as many counties. Parliament itself, where we're sitting, which really should be the hallmark of constitutionalism, owes us 81 million shillings as Nairobi County. And I hope I can get a check today while being here. It owes us the money. We've done a new valuation draw. Other counties now will do it from the new rating act. We did it from Cap 267 of 1956. And yet, all we get is excuses that, oh, give us your new valuation draw, we are not supposed to pay. Yet that is the law. So if Parliament is not following the law, how do you expect anybody else to follow the law? Finally, the additional costs that are going to come to counties on account of the medical equipment scheme that has now expired. If Kirinyaga is going to spend 170 million, you can imagine, and 170 million in total, what she'll spend might be, close to a third of a development budget, So you can only imagine what Kisumu will have to do for replacement, what Nairobi will have to do. And this is yet, despite the fact that for all these years, MES money has been deducted from counties' money irregularly. So in fact, all that equipment should revert to counties because we've been paying for it. It's been deducted at source, and that's something you check with the controller of budget. Same as KIPES, same as the health insurance, the housing levy, the money that is there. Some of us support us to be able to build houses, but it means there's an additional deduction that we must remove from the payroll of our employees. Thank you, Chair.
Professor?
Mr. Chairman, thank you very much. I want to make a very simple point that I think the chair did say that the devolution did not come easy. It was after a long struggle in this country to get a kind of government that will respond to the needs and the ambitions of the Kenyan people after independence. You know that we had a devolution at independence by Jimbo, but it didn't last long. After many years of struggle, we realized that if we had continued with the evolution from since then, things would have been different in this country in many ways. But having said that, the Senate is established by law, by the Constitution, to look after the interests of the counties. We are not pleading for anything special here. We're just saying the Constitution exists, the schedules exist, that divide functions between counties and national government. And really, if you come to think of it, in the counties where the rubber touches the ground, where services are delivered to the people, where the functions that the counties perform, the counties cannot perform those functions unless the Senate does its part in its budget policy statement, which is a policy statement. It lays the framework for division of revenue so that the counties can deliver services as constitutionally provided. So I don't think we have come here to convince the Senate really. We just come here to look at the budget statement, policy statement, and to add on to it how we can get resources to deliver services effectively. Now, the national government seems to be in a hurry to perform county functions. I don't understand why. I thought they had enough in their arms, in their hands to do. One example that has been there for a long time, and that whether you know that we talked about it in the Senate, is why we should have Kenya Roads Board, Kenya Roads Authority, Kenya Rural Roads Authority, Kenya Bad Road Authority. When those roads are in the counties and counties given money can do them. And I'm telling you that this is my second term as governor. And I really don't know how effective Kenya Rural Roads Authority, Kenya Bad Road Authority is any more effective than the county government. Now, you can save a lot of money if those two authorities were annulled. The personnel, the money paid to employees and all that, the time waste and so on, we would do it more efficiently because we are really doing it. So it is those areas when we are making budget policy statements, perhaps makes comments about what are the areas of expenditure in the Kenyan government now on functions that the national government does, which could be done much more effectively by the counties, rather than the other way around that the chairman was pointing out. What are the functions that the national government is now trying to do, which the counties are doing or ought to do? And when that is done, then we get problems with how to allocate money in the budget, because somebody is actually doing a work that somebody else should be doing. And if money went there, then the 450 billion that we are asking for would be very easy, because we'd have many more functions to do than that 450 would finance. So we would then be forced as a country to look for more money to do that. So when government says that we should increase our domestic revenue in counties, that's right. We also want to do so. That doesn't mean that you don't give us what we deserve constitutionally, and that doesn't mean that we are not doing our best to increase our own revenue. Governor Roba knows that. We discussed this a lot when he was in the Senate, that whereas the counties are doing their best to try and increase their own revenue, the national government is doing its best to cut its budget, which should be there by law. So I think the Senate, I think we are together here really with the Senate, that both of us are interested in making sure that the Constitution is respected. Both of us are making sure that the money that is given to the county go to support the functions that the counties ought to perform. They are not new, they are there. And the counties are prepared to work for more revenue raised in the counties if indeed there's encouragement on the government side to make sure that we build capacity to raise that revenue. We cannot build the capacity if we are spending too much time arguing about what exists by law rather than what it doesn't exist. Thank you very much.
We are here, and what we are pleading for is the law to be followed in this allocation. Simple as that. Let's follow the Constitution, which provides, and our chair has made a good presentation, and I'm very happy that my senator is here. Based on the proposed increment of 5.7 billion, LAM will get less than 20 million. And you can see where that will take us. That's all.
Governor Mudomi.
Chair, much has been said, and I don't want to repeat what's already been said, just to support that we look at the additional 5.7 billion that is proposed to be increased in the previous allocation. If we divide that by 47 counties, that is 121 million per county. And if it was shared equitably, and that is why a county like Lamu will be getting 20, Tharaka-Nithi will be around 25. Remember, that is not enough even for salary increment, leave alone the other expenditures we've talked about. Of interest to us, Chair, and the senators, is that some of the functions that are being done by the national government will be an extra load to the counties. Look, for example, the affordable housing. When you put affordable housing in my county, as a county government, I need to provide services. I need to take a road there. I need to supply water there. I will need to do sewerage. I need to collect garbage. All that is extra cost that is being imposed on us. Yet we do not get an additional allocation, or there is no consideration when you're considering funding the affordable housing. Secondly, Chair, my colleagues have talked about functions that are being clawed back by the national government and being funded. In health, that is where they do well. And there's one particular one that is been of it's actually an interruption of services, because it even caused a bit of chaos in the structure we have in managing CHPs. There's a proposed policy to employ a liaison officer by the national government and transferred to the counties to manage and liaise with the national government on the activities of CHPs. CHPs have been operating in counties for almost as old as devolution. It's only that now the national government took interest. So counties that have been having the number of CHPs we've talked about here, and they have not even increased the numbers, have been running those CHP programs without intervention of the county, of the national government. Where do they need to employ more officers, and with resources from where, to come and scout, or rather even man the CHP program in the counties? And lastly, and this one is on a light note, I know that when my Kenya Kwanza coalition, which I belong to, even Dr. Kalwale belongs to, was campaigning, they promised Kenyans that the minimum they'll give the devolved functions of the shareable revenue is 35%. So Senate, don't be a party to tainting my Kenya Kwanza coalition. Please help them realize that they need to honor their promise of 35%. My chair of the coalition of the EDA has unfortunately left the room, but it's important for us to help them to stick to what they promised. As for the 13.5%, that will just be blatantly breaking the law by, again, my Kenya Kwanza coalition. Please don't assist my Kenya Kwanza coalition to break the law. Thank you very much.
We appreciate that the committee is willing to support and push this agenda of minimum 15%, but we're not going for minimum. That was just the bare basic, and you have acknowledged the same. We will provide additional documentation both for this BPS and also for that which we did not submit on debt management, and also the strategy on revenue collection. We also commit that the team, the secretariat, and the governors will be available, will join the meeting that has to do with the issue of county headquarters that has been raised by our colleague Governor Mugomi. Once again, thank you, and we look forward to a better relationship this year, and more collaboration and synergy, and I urge